Thank everyone for taking time out from their day to join us this afternoon. Again, just a couple of housekeeping items. If you could put your phone on mute during the first part of today's webinar, appreciate it, but please don't put your phones on hold, because that typically results in background music being piped in. And we have set aside time at the end of today's webinar to answer any questions that you may have. And so without further ado, we'll go ahead and get started. Again, I am Glenn Moy, and I'm a Senior Program Officer here at the California Healthcare Foundation. And joining me today is Ron Wacker, who is the Project Manager for the Electronic Prescribing of Controlled Substances Project. And Ron is an independent contractor who has worked with the Foundation over many years on a variety of e-prescribing related projects. Just so you have a sense of the agenda for today's webinar, I'm going to first start off with introductions and a little bit of background about the Foundation for those of you who may not be familiar with us. We'll also then go into a little bit of background around the project itself, and why the Foundation is initiating this project and issuing this RFP. We'll then go into a detailed overview of the project itself, including eligibility requirements, key information, or key dates, and then kind of the timeline of the overall project. And as I mentioned earlier, we'll then close out with questions and answers. Again, so just to start off, those of you who may not be familiar with the Foundation, our vision really is to work as a catalyst to fulfill the promise of better health care for all Californians, and we support ideas and innovations that improve the quality, increase efficiency, and lower the cost of care. We're a private nonprofit foundation that was created when Blue Cross of California converted from a nonprofit to a for-profit company. We've been around since 1996. With our main office was located here in Oakland. And we do have a smaller office up in Sacramento. That's really where our state policy office is located. Every year we make about $40 million in grants for a variety of projects and initiatives. And the Foundation is organized into 4 program areas: Better Chronic Disease Care, which is the program area that I am a part of. We also have our Innovations for the Underserved group, our Market and Policy Monitor, and our Health Reform and Public Programs Initiative. As far as our approach, again, we try and work as a catalyst to fulfill the promise of better health care. We try and support ideas and innovations that improve the quality, increase efficiency, and lower costs. Our work takes a variety of forms, so we do everything from commission research to publish and disseminate information and convene meetings of key healthcare groups and try and support the development of programs and models that improve healthcare in California. Given that we're a 501c4, we do not take any kind of positions on legislation, and we are not an advocacy group. The Foundation's organized into 4 program areas, and I am part of the Better Chronic Disease Care program. As you'll see, there's really no mention of health information technology in any of the 4 program areas. That's because our focus on health IT kind of pervades all of our work and has since the very beginning. Since the Foundation's creation in 1996, we've always felt that health IT could play a key role in improving healthcare delivery, cost, and efficiency. So I want to switch gears a little bit and just talk a little bit about why the Foundation is issuing this RFP and why it's initiating this project around e-prescribing of controlled substances. As many of you may have seen in the most recent SureScripts report, 36% of prescriptions today are routed electronically, and over 58% of office-based physicians are prescribing electronically. So as a result of meaningful use and high-tech, clearly adoption of e-prescribing is on the rise, both here in California as well as nationally. And of the total number of prescriptions that are written annually, about 11% are for controlled substances. So, prescriptions for controlled substances are something that the majority of providers have to write as part of their normal day-to-day routines. But up until very recently, there's been a restriction on the ability to prescribe controlled substances electronically. Only recently, in June of 2010, did the Drug Enforcement Administration actually issue interim final rules that permitted the electronic prescribing of controlled substances, but only under some very strict security and auditing requirements. And so as a result of these requirements and everything that needs to be done in order to comply or to be compliant with the DEA regulations, adoption of electronic prescribing controlled substances, or EPCS, to date has been limited as pharmacies, e-prescribing vendors, information exchange networks, et cetera, slowly comply with the requirements and make the necessary changes to their systems in order to be able to support EPCS. And so as a result, both prescribers and pharmacies in many states, including California, are forced to maintain kind of dual workflows. So one for an electronic one for non-controlled medications and a paper-based one for controlled substances. And so not only does these dual workflows create inefficiencies from a process standpoint, they can also result in patient safety issues. And so because of these challenges, that's why the foundation was really interested in seeing what we could do to accelerate adoption of electronic prescribing controlled substances. So really the goals for this project and for this RFP is to pilot the electronic prescribing of controlled substances in up to 3 California-based ambulatory provider organizations to better understand the issues and challenges associated with trying to implement the DEA regulations, how they affect both physicians, community pharmacies, and health information networks, and then hopefully to share these lessons that we learn over the course of the next 12 months broadly, both within California and nationally, to facilitate both e-prescribing adoption as well as the meaningful use of electronic health record systems. With that, I'm going to turn it over to Ron Wacker, and he's going to go into further detail about the RFP and the project itself.
Hello, everyone. We're going to start on the first slide here on who is eligible. What we've decided to do with this grant program is to focus on ambulatory provider organizations broadly defined. And that obviously includes private medical groups, community clinics, or other similar delivery organizations. Secondly, we want any applicants, grantees, to have been e-prescribing for non-controlled substances for at least 6 months and or have achieved stage 1 meaningful use requirements. Third, the grantee will need to be using software that is certified for EPCS by the 4th quarter of this year, and also be prepared to implement e-prescribing for controlled substances early in the 4th quarter. For those of you that are familiar with the SureScripts website, you know that there are about 200-odd vendors of EHR and ERX software listed. They've added a column at the far right which essentially is for EPCS certification. And just so you're aware, as of yesterday anyway, 5 vendors are certified for prescribers: Dr. First, GE Healthcare, New Crop, NextGen, and RxNT. So basically, one of the major issues here is, as Glenn has pointed out, the relatively slow rate of adoption of EPCS certification by prescriber vendors. These are the 5 that are currently able to legally process controlled prescriptions. We've taken a relatively broad view of how grant funds can be used in order to facilitate implementation of EPCS. And that includes purchase and upgrade of computer hardware and or software, purchase and implementation of security-related hardware or software, various services that may be necessary to support the project, including technical, project management, and training services, the completion of the DEA-mandated identity proofing process for prescribers, and finally and importantly, support for participating community pharmacy partners that grantees may identify. As some of you know, there are some barriers on the pharmacy side with respect to e-prescribing generally and more specifically EPCS, and we're certainly allowing consideration for support for those partners with which grantees may actually develop arrangements on EPCS implementation. We anticipate that grant funds will be approximately $50,000, with the actual amount varying depending on the size and the scope of selected pilots. And we're looking at a 12-month period for the grant with a 9-month implementation phase and 3 months post-implementation evaluation phase, ideally beginning in October 2012. These are some key dates that are contained in the RFP. There are no changes here. Basically, we will be posting this webinar, the audio version of it, by Monday, at the end of day Monday, September 10th. If you have questions, please send them to me at ronwacker@yahoo.com. And basically, with respect to that, any questions that we receive before or by Wednesday, September 12th, we will then post answers to those questions by the 17th. In terms of questions that I may receive, if we can answer them immediately, we will. You won't have to wait the time period shown here, but there may be questions where, frankly, Glenn and I have to noodle them a little bit to come up with the right answer. Ultimately, the proposals are due September 28th at 5 p.m., and finally we'll announce awards on October 15th. You'll see in the RFP that the proposals should be sent to a specific email address at the foundation. And we want electronic copies. We don't want them mailed, but they do need to be sent to that address. The selection criteria we've identified are very much complementary in terms of us looking for strong proposals that, in fact, will really lend themselves toward learning a good deal about EPCS implementation. First, we're concerned and interested in the magnitude of the local impact of what the grantee plans to do, the robustness and feasibility of the work plan, the degree to which the application reflects a strong leadership and resource commitment by the grantee, and the readiness of the grantee's EHR or ERX vendor to support EPCS. Also of importance is the status of discussions that you have had or are planning to have with key pharmacy partners in this process. Just to comment about that, I know I've had some questions recently, and I'll just address this now. We do have a fairly high number of pharmacies that are ready to process EPCS scripts. I'm just going to list them for you. There's one important addition that I noticed yesterday. These are also on the SureScripts website, but let me just list them. There are 7. Cerner Etreby, which sells software to independent pharmacies, has an EPCS certified version of that software available. And I know there are a number of independent pharmacies in California using Cerner software. CVS Pharmacy is now listed as EPCS certified. HEB Pharmacy, which I think is primarily in Texas, MD Scripts, Rite Aid, SuperValue, and Walgreens. Now, we've had partnering discussions already about this grant with a couple of the major chain pharmacies, Rite Aid and Walgreens, and I've already expressed a willingness to help us work with local stores that you as grantees may identify as partners with whom you want to send your EPCS scripts, and also look at the workflow that you create between yourself and the pharmacies. There are several expectations of grantees. They're not onerous. They basically go to participation in key project meetings and submission of status reports, the designation of an on-site project manager that will be our go-to person as we proceed with the grant, participation in key project evaluation activities, which would include on-site visits at the start and at the completion of the project, a phone interview during the project, the grantee facilitating our interviews with key pharmacy stakeholders, and then the facilitation and collection of key data around agreed-to measures. You will notice that on page 8 of the RFP, there are some tentative measures that have been suggested. These are not finalized, and we are very interested in grantees identifying measures that they think would be important to collect during the course of the project. We have the Foundation has retained American Institutes for Research to conduct an independent evaluation of the project. And basically, on this, we're taking a case study approach, and I've listed here 3 of the core research questions that the case studies would, in fact, explore. How were prescribing and pharmacy workflows affected by the implementation? What lessons can other provider organizations and pharmacies that are considering EPCS implementation learn? And what are the implications for policymakers and regulators? Now, questions and comments can be sent to me at the address shown here. The request for proposal and other project-related information is available at the website shown, and this is the address to which, in the 3rd bullet, your application should be sent by Friday, September 28th at 2012. Excuse me. First, we're now going to open it for questions, but I just wanted to review for you a couple of other questions I've received over the last week or so. There is a limited amount. I've had a question about what kinds of technical assistance might be provided. We have limited ability to provide technical assistance to grantees outside of the grant funds you would receive. Now, I was also asked by one pharmacy representative, why are grant funds only for provider organizations and not for pharmacies? And as I've previously indicated, the grantee has the ability to, in fact, provide some of the grant funds to a pharmacy with whom they're partnering in order to achieve pharmacy readiness to receive the scripts. We received a question whether or not public hospital outpatient clinics are eligible for grants. The answer is yes. Ambulatory care clinics of public hospitals and other entities are, in fact, eligible. Finally, we received a question regarding whether or not county mental health facilities are eligible. There's no categorical designation of medical versus mental health services in our approach to this. I think, though, that other eligibility criteria might well apply, including whether or not a county mental health clinic or other mental health outpatient facility actually has certified software and can electronically transmit scripts to pharmacies. So those might be more pertinent in terms of answering that question. At this point, we'll open it. Okay, we have some up here. Let's see. Is it Diane Wolf on the line?
Yes.
Diane, would you state your question? I'm having a little trouble reading it here on the.
Diane,
can you pose your question verbally to the group and to us? It looks like she's been disconnected.
Why don't we come back?
We will come back if she gets back on.
If anybody else has any questions.
Any other questions?
Yes, hello.
Is this Brenda?
this is Cecilia. We are calling from an IT company. Well, on there, can you hear me?
Yes. Yeah, a little hard to hear you. Go ahead.
Let me undo the speaker for a little bit. So we're wondering, we have multiple providers and multiple practices. How many providers should we enroll with this project, or is there a limitation, or like do we need to enroll all of our providers because we have about 64 providers that are on the EHR program right now?
We don't have a specific number of providers in mind. It'd be good to think in terms of, though, the review criteria we're using. Clearly, the number of providers necessary to have some kind of magnitude of impact locally will vary based upon the locale, whether it's rural or urban and that sort of thing. So we do not have a specific number of providers, either as a minimum or a maximum.
So the grants are not going to work on a per provider basis. It'll be basically on the strength of the overall proposal and things like, as Ron indicated, the experience that the organization has in terms of implementing both health IT as well as e-prescribing, and again, so those factors. So we're not providing individual payments to providers.
Okay. Okay.
Okay, I have a question here about, I think it's from Sarah, from Brenda, about what you would like to have included on the high-level work plan. Basically, we want the work plan to, number one, show a time-phased implementation of EPCS for an identified number of providers, and what activities are planned vis-a-vis the pharmacies that would be the receiving partners of the scripts. What we'll be looking for, obviously, is the degree to which the work plan is feasible, given within a certain time frame, and the magnitude of the impact in terms of pharmacy partners and number of scripts, that sort of thing, what specialties you plan to roll out, in what order. It would be the typical kind of IT work plan that you would have in an organization that I think you would be normally preparing.
Thank you.
I think we have a question here about, I think it's from Charles Kitzman, will multiple pharmacy involvement increase chances of award? I think a fair answer to that would be yes, to the extent particularly that you need more than one pharmacy in order to have the kind of impact locally that we're seeking. But it's all dependent. I mean, if you have one large pharmacy in a town and it's the predominant pharmacy, one might be enough. It's just hard to answer that question independent of the specific venue, the geography, and the market that we're talking about.
Yeah. I mean, to the extent that we are trying to really understand, as you said, as we mentioned earlier, the issues and challenges with implementing EPCS, that for any proposal, the greater number of exchange partners are involved, I think from our perspective, increases the likelihood that we'll get better understanding of what those particular challenges for different types of pharmacies and different organizations that are utilizing different systems. So I think that increases the overall learnings that we'll be able to gain from this project. So from that standpoint, I think that while it isn't the only criteria, it definitely will be a key criteria. I think, as Ron indicated, it probably strengthens a proposal.
Now, I see Diane is back, and then we have a question from Josh, which we'll get to. Diane, was your question related to what do you do if you don't have an EPCS certified vendor software system? Is Diane back on? Diane Wolf? Okay, I'll skip to Josh. Josh, if I understand your question, that we want to be looking at EPCS implementation through a 9-month period that essentially would begin in an October timeframe. So if you have a vendor that isn't ready until sometime next year, then we wouldn't be able to start in October. Does that get at your question?
Well, I guess from our perspective, you know, our vendor right now, Epic Systems, is actually well into the process of getting certified. They're actually undergoing the audit right now, but they anticipate it'll be quite a few months, that it might not be until next spring at the earliest that they would obtain their certification. So, but there's no reason that we, for example, couldn't work with them through that entire time to get things built and tested on our end, and, you know, all of the politicking that would be necessary with the local pharmacies to make that happen, so that we could be ready for a go-live, if you will, to start sending next July, in alignment with when the monitoring period would be post-implementation. So I'm just curious why in the eligibility requirements a line has been drawn with December 31st being the timeline when your vendor has to be certified.
Well, actually, the certification, we've put in fourth quarter, so you're picking the very end of the fourth quarter as the date. We do have 5 vendors that are already certified, and it was our hope to be able to at least get 3 pilots going based on those vendors that are certified as of now or will be between now and October. So I see your point, but we're really trying to get something started now with this process, in large part because there's very little information out there on EPCS implementation. As some of you know, the only real study was done at Berkshire Health System pre the IFR being issued in 2010. And we would like to be early in learning as much as we can to help other providers. But I do see your issue.
Josh, and this is Glenn. So I think that one clarifying point, so I think this is partially semantics, but so from the project standpoint, when we say implementation, the implementation phase consists of what would, I guess, typically from an IT standpoint be the implementation phase in terms of, you know, installation and actual implementation of the software, as well as you know, a 6 or 9 month period of actual go live and providers actually prescribing prescriptions for controlled substances. And then at the end of that period, you know, where we've indicated there is a post-evaluation, that is more of the grantees working with the American Institute of Research to pull together all the learnings and the evaluations that have been collected during the previous implementation phase, and pulling that all together into a set of reports. So I think that's, from our perspective, how things kind of fall out. And so therefore, having, you know, an Epic or someone being certified and being ready in summer of next year doesn't align with how the timetable for this project. But again, I think it's
okay. Yeah, that's some clarity that was missing. Yeah, because an implementation, yeah, usually goes all the way through the go live, but in the vernacular it's missing here. You're actually intending provider organizations to go live pretty much this fall and start measuring all throughout the winter and spring.
Yeah.
Okay. Yeah. That's helpful. That's some clarity that was missing. Thank you very much.
We have a question from Dr. Lawrence Bernstein. Dr. Bernstein, as far as we know, again, we use the SureScripts listing of EPCS certified vendors. At this point, I'm not aware of any Allscripts versions that are certified for EPCS.
Okay, thank you.
Yeah, so if you don't, if you did not hear your particular system mentioned earlier during the webinar, that doesn't necessarily mean that's not the case. That is, the list that we're working off may not be the most accurate. So it probably would make sense to reach out to your respective vendor and find out what the status of their efforts are. Maybe, again, they have been certified and it just, you know, what SureScripts, it hasn't been updated yet, or maybe they're very close. And so I think it's probably makes most sense to go directly to your vendor to figure out what the status of. And and if they are close, you can probably kind of nudge them or encourage them to move a little faster.
I'm not seeing any other questions posted on the webinar. Are there any other questions out there that you'd like to pose right now verbally? I'd like to talk to that young person if they have a question.
This is Ken Shell at the Children's Hospital in San Diego, and I've heard we are an Epic served provider as well, and that was one of the things we wanted to get in because we are a pediatric-based hospital. And I was just curious, do you have any potential, the providers that are certified, who are those, or is that information that we can get our hands on?
Yeah, let me repeat that again because I think that's important. And in fact, one of the issues here is that, for example, the Drug Enforcement Administration is not maintaining a list of certified vendors on either the pharmacy or the prescriber side. And that's become an issue for many stakeholders. SureScripts, however, requires demonstration of EPCS certification for any software systems connecting at either end of the transaction. And so they have been posting the names of new vendors that are in fact certified. But on the prescriber side, at this point, there are 5 that are listed as certified by SureScripts. And that means to be able to connect to the SureScripts network to send prescriptions for controlled substances. Dr. First, GE Healthcare, New Crop, NextGen, and RxNT. And then, of course, you have to get the right version of their software that's EPCS certified. And there is information on the website, on the SureScripts website, concerning which version that is for each of those companies.
But I guess my understanding is on the back end, the pharmacy has to be certified as well, correct?
That is right. And in fact, depending upon where you live or in what pharmacies you rely on, there's an increasing number of pharmacies, particularly among the chains, that are certified. And among them, I'd say Rite Aid's, Walgreens, and CVS are now all certified according to the SureScripts website. And that, I think, dramatically improves the likelihood that there's somebody to catch the controlled substance pass at the other end. Also, Cerner Etrabie is certified, has software that's certified, and Cerner is, as you may know, a vendor to many independent pharmacies.
Right, and so you can understand our concern from a children's hospital perspective because a lot of those chain pharmacies don't carry certainly products that are usable in the smaller, in pediatric patients. That's why we're looking to get our pharmacy certified. But I think the opportunity here is to understand the entire process, and I'm really grateful for the call. I learned quite a bit.
Are you talking about an in-house pharmacy?
Yeah.
Yeah, and they have to go through the same process of certification.
Yeah.
Right.
So again, I think that since there is no centralized list of all the pharmacies that are certified, that's part of our challenge. So, but again, I think that we're interested that an in-house pharmacy is definitely one of the scenarios that we would be interested in looking at and seeing what the challenges are in trying to implement EPCS in that kind of an environment, in that kind of an exchange scenario as well. But obviously, the challenge being you need to have systems on both ends that are certified.
Right, and we are looking to put an application in, but because we're an Epic shop, and Epic, again, I think like the previous gentleman said, is not looking to get their certification until well into next year. It seems our chances are slim of becoming a demonstration project, but that will still continue to move forward nonetheless.
Are there any other questions?
Once? We couldn't have possibly have answered everyone's questions.
Okay.
Hello, somebody have one?
Yeah, I do, and it just came up a minute ago when you said something. My name is Brenda. I'm with Vista Community Clinic, and you said that you need to make sure that you have the right version of your electronic health record. We're a next-gen organization, and we're about to do a KBM upgrade in the spring. So do I need to make sure that we have the correct version now in order to be able to do this? Or
you would need to have it in the fourth quarter of this year, and if I'm remembering right, the next gen version, I think it's 5.7, that has the EPCS certification.
Okay.
But you need it. I would check with next gen on that to be certain.
Okay, we will. Thank you so much.
Any other questions?
Oh, I guess I do have one more question. Is it possible to get a copy of the slide deck?
So you may not have seen, so the slide deck is actually already posted on the project webpage. So if you go to
nice.
So if you go to www.chcf.org/EPCS, it is already there. But obviously, if for whatever reason you can't get it, feel free to email us or email Ron. And then on that same project page or web page will be the recording of today's webinar. Then we give us, like I said, I think till Monday to post that, but that should be available as well. And as Ron indicated, folks have between now and next week to submit questions. And once we have actually collected everyone's questions, both the questions from today, as well as any questions that may come in via email over, like I said, the next week or so, we will pull all of that, all those questions and the answers together in a single document and post that onto the web page as well. So the web page will be your one source for all information about the project going forward.
Okie dokie.
Okay.
Anything else? Any other questions?
Okay, well, again, this is not your only opportunity to answer to ask questions. As we indicated earlier, if you have questions between now and
if you have questions between now and, hold on, I got to pull up the right page here. By Wednesday, September 12th, if you could get the questions to me.
Yeah, so if you've got questions, again, please send them electronically to Ron Wacker at the email address that's been provided. And again, we will then pull together all of the questions and answers and post them onto our website so that everybody can benefit from all the questions that have been raised.
Yeah, one little footnote on that. If you send me a question after that date, I'm not going to ignore you. It just may not get posted on the website.
So again, we'd like to thank everyone for taking your time today to be on this webinar. And hopefully we'll see some proposals from all of you over the next month or so. And again, thank you.
Well, thank you.